From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello, everyone. I'm Genaye Channel with my co-host, Dr. Philip Katz, the chairman of the Gastroenterology Division at Einstein Healthcare Network. And this is the Gastroenterology Show. Our topic is colon cancer screening. So, doctor, let's get right to the questions that stem from our viewers. What exactly is colon cancer?
So, Genaye, colon cancer is a malignant tumor, a growth, a mass that occurs in the colon, which is the large intestine. It's composed of the rectum and the colon. They're a little bit distinct, but for all practical purposes, the large intestine, when it develops a malignant tumor, that's what colon cancer is.
So how is it typically diagnosed?
So it normally will come from a polyp, from a benign but premalignant growth, turn into the cancer itself. And if it's not diagnosed by screening, which would really be the best way, then the patient will get symptoms. They may have bleeding. They may have a change in bowel habits, so they would become constipated, for example. The caliber of their stools might change and they would become thin. So any change in bowel habits, diarrhea when you were constipated if you were normal, that would be a worry. Normally the disease is diagnosed either by a screening exam, but ultimately confirmed with a colonoscopy.
Okay, so let's talk about the colonoscopy. I know I've heard it several years in my family. I'm turning this age. Oh goodness, I need to schedule a colonoscopy. So tell us about that as far as the age is concerned and as well as what the exact procedure is.
Sure. So as a little bit of an overview for the audience, what the American Cancer Society and many other societies, including the GI societies, recommend is that people have a screening exam of some type at a certain age. Now, if you are average risk, then that is for most people at age 50. The American Cancer Society recommends a list of tests. Gastroenterologists like myself feel like a colonoscopy is the best test because it allows you to examine the colon with a lighted scope and then remove precancerous lesions at the same time if they're there. You could be screened with a stool test for blood. You can be screened with what's called a virtual colonoscopy, meaning an X-ray, and you could be screened with even a capsule endoscope. None of them offer the value, in a gastroenterologist's opinion, mine, as a colonoscopy. So a colonoscopy is an examination of the large intestine with a lighted scope. An endoscope is passed into the rectum and up through the entire colon. It's done after the patient takes a preparation to clean out their bowels, and then sedation either by an anesthesiologist or by the doctor who's performing the procedure so that they're comfortable and they don't have any pain during the procedure.
So why is this procedure so important?
Well, the reality is that it allows us to look for precancerous lesions. Typically that's a polyp, and remove those polyps. If we do that on a regular basis, if you have no polyps, then you need another colonoscopy in about 10 years. If you have a polyp or polyps, we remove them, and then you are surveyed on a certain schedule. And since we've been doing this screening on a large scale, we have reduced the risk of dying from colon cancer substantially. And that's basically why it's important, because without symptoms, you may be harboring something that could become a cancer. It gets removed, treated, and you don't die of the disease.
Dr. Katz, you mentioned polyp several times in this discussion. So just for our viewers out there, what exactly is a polyp?
Well, for all practical purposes, Genaye, that's a growth. Polyp has different shapes, but for the public, it looks kind of like a little mushroom. It's got a stalk and a head. Sometimes the head is just flat with no stalk. It's a change in the way the colon tissue reacts to something. There's some change in genetics, and normal tissue generates into this premalignant tissue, and over a time, 4 to 14 years, it grows from nothing into a premalignant and then potentially a malignant growth.
Who is most at risk for colon cancer?
So, Genaye, the most common risk is a family history, what we call a first-degree relative. So a sister, a brother, a mother, a father, a grandmother, a grandfather. There are some variations on that theme, but for practical purposes, that's the thing that people should think of for the most. There's some evidence that African Americans might be at slightly increased risk, and some people recommend earlier screening for African Americans. And then there are certain diseases that can increase the risk of getting cancer. So Crohn's disease, ulcerative colitis, and then there are some hereditary syndromes that are probably a little bit beyond the scope of our discussion today. The one place that I would just highlight is that women with multiple cancers in the endometrium and the breast, if you have more than one cancer, you can be at increased risk for colon cancer as well.
Well, Dr. Katz, thank you so much for this great information.
Thank you.
You're welcome. Be sure to watch more episodes on this topic and other issues of interest to all patients here on the Gastroenterology Show. We will see you next time.
From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.